You are likely losing your B+ grade in the first 30 seconds without realizing it. If you walk into the room and say, "Hello, I'm the doctor. How can I help you today?" you've already failed the first test. The Roleplay card usually tells you that you've seen this patient before. When you ask, "How can I help?" you're telling the examiner you haven't read the notes. You sound like a student, not a specialist. To fix this, you need to lead with authority. Here are 3 phrases you can use to lock in that B+ immediately. You use the reviewer frame when the card mentions a previous visit or test results. This proves you are prepared. Try saying, "I've been reviewing your file and the notes from our last consultation, and I see you're here today so we can discuss your blood test results." Have you noticed the shift? You aren't asking them why they are there. You are telling them you are ready to work. It sets the agenda from the very first breath. You use the targeted check-in frame for patients returning with a known condition. It sounds like this. "It's good to see you again. I understand you've been trialing the new medication for your blood pressure. How have you been finding things since we last spoke?" With this phrase, you hit the clinical communication criteria for relationship building instantly. You are showing the examiner that you understand continuity of care. Finally, you use the collaborative lead frame when you need to dive into a complex management plan. I've looked over the specialist's report, and before we discuss the next steps in your treatment, I'd like to hear how you've been coping with everything. You are acknowledging the evidence, but centering the patient. You've moved from phase 1 to phase 2 of the ASE framework in one sentence. Remember, the goal of these phrases isn't just to be polite. It's to move from phase 1, analysis, into phase 2, script, with certainty. When you use these openings, you are doing 3 things. 1. You are establishing your authority as a senior consultant. 2. You are proving to the examiner that you have analyzed the patient's history. 3. And most importantly, you are saving precious time for your management plan. Every second you don't spend asking, "How can I help?" is a second you can spend locking in your B+ at the end of the roleplay. When you start like a specialist, you finish with certainty. If you want to see exactly how to transition these openings into a high-scoring management plan, watch the full OET Medicine Speaking Mastery playlist on our channel. And if you're not sure where your specific marks are leaking, go to the link in the description and take the 60-second Gap Audit. It's the fastest way to see what's standing between you and your B+ grade. I'll see you in the next OET Medicine Speaking Breakdown.